Welcome back to my channel. I am Dr. Lindsay Harding, and this is The Medical Madam. In today's video, we are going to be talking about testosterone for women. So specifically, we are going to be talking about the perimenopause phase and the importance of testosterone for women. Testosterone is often forgotten about because it's not considered to be a primary female hormone, but it serves many, many important roles. Everything I'm going to cover in today's video is actually true whether you are menstruating, in the perimenopause transition, or you are postmenopausal. So you're here watching this video about testosterone today, either because you think or know you have symptoms of low testosterone, or you just are interested and want to learn more about its importance for women. Great news, we're going to cover both of those. So what are some symptoms of low testosterone levels in women? First off, we have the physical signs, which are going to be a loss of muscle mass primarily, but you are also likely losing bone density, which is going to be something that you're not going to necessarily see or feel. Other things are going to be anxiety, low motivation, but also lower self-esteem, lower mood or depression. In terms of appearance, oftentimes the women who have always had a low testosterone level, your testosterone level never really peaked. You might have low amounts of hair all over your body, or like almost no body hair. That's often a sign that you actually never had very much testosterone to begin with. But for women who do have body hair and have low testosterone at a certain point, your testosterone is declining. Receding hairline, specifically at the temporal areas, is a very characteristic sign of low testosterone. And lastly, just like men, low sex drive is also a very common symptom of low testosterone. Women produce 20 to 30 times less testosterone than men do, but it is still a super important hormone for our health. So if you're watching this video because you are interested in potentially using testosterone as a replacement therapy for low levels for yourself, let's talk about the role of testosterone in women before we get into all the other super fun stuff about testosterone. In perimenopause, our hormones LH and FSH, which come from the pituitary gland, which is up in the brain, and they go to our ovaries and tell our body to produce estrogen and progesterone. So during perimenopause, your levels of LH and FSH fluctuate greatly. This is what causes irregular periods. It's what's going to cause the mood swings, the hot flashes from low estrogen. It's going to cause an increase in body fat, usually, and a decrease in muscle. It also often causes low libido, low energy, low mood, more anxiety, all of those super fun things that everyone looks forward to during menopause. In the menstrual cycle, we have two main phases, the follicular phase and the luteal phase. In the follicular phase is when menstruation happens during the first half. They're separated by ovulation. So the main hormones that we talk about for women are estrogen and progesterone. Our estrogen production is at its lowest during the first part of the follicular phase during menstruation. Estrogen, if my pen will work, estrogen is going to rise, and right around ovulation, it's going to hit about its maximum, and it's going to start to drop right around the time of ovulation. It will continue to drop during the luteal phase, the first bit, and then it will surge back up a little bit, and then it will drop off again, getting ready for menstruation in the first 7 days. Progesterone, on the other hand, will stay on that lower end. It will stay low, and it will increase during ovulation. Will go back down, and then it will increase again. Progesterone typically is a bit higher than estrogen during the luteal phase. That progesterone is preparing the egg for implantation. If there is no fertilized egg, your levels both drop off, and that's when you get menstruation. So during this time, LH, your luteinizing hormone, is pretty low. Again, it's also at a low level. But luteinizing hormone plays an important role here of stimulating ovulation. So right before ovulation, LH is going to go way up and it's going to drop back down. So that surge in LH is what causes the ovulation. But the other thing that happens is that surge in LH also is going to increase your testosterone. So your testosterone's pretty low here, and it will increase a little bit during this phase. Then it will go back down. So when we think about perimenopause, LH, the luteinizing hormone that's stimulating some of that testosterone here, that nice little increase that's going to happen. These are made by your pituitary gland in your brain. And so they are what are going to tell your ovaries to produce estrogen, progesterone, and testosterone. In perimenopause, LH and FSH levels become less predictable and they fluctuate more often. So all three of these hormones are going to start declining as your ovarian function decreases with age, but they will not all decline at the same rate. So during different parts of your cycle, at different months, you might get surges of estrogen still. You might still get surges of progesterone. You may or may not get the surge of testosterone. But unfortunately, they don't all work together the way that they should at this point. And that's because your LH and FSH levels become unpredictable. They are actually increasing with age because these hormones are made from your brain, and your brain is still telling your ovaries to function, even though the ovarian function decreases. So in the end, the ovaries win that final battle, and you will stop menstruating and you will stop having these fluctuations in hormones. But with that, you will lose that production of testosterone that comes from that surge in LH. Even though the LH is high, your ovaries are not functioning the way that they once were, so you do not get that increase. Aside from the obvious things like weight gain, muscle loss, low mood, anxiety, depression, difficulty sleeping, your skin also typically changes with more laxity in the skin, and that's a decline in testosterone as well as estrogen. Testosterone plays a really important role in keeping your bones strong and healthy along with estrogen. So the decline in testosterone that happens over age can contribute to osteoporosis and osteopenia, which is the precursor to osteoporosis. In cardiovascular health, so regarding your heart and the vasculature throughout your body, which includes vasculature in your brain, so risk for dementia and strokes, there are several studies that actually show that higher levels of androgens, such as DHEA, androstenedione, and testosterone, reduce your risk of cardiovascular diseases, specifically reducing the risk of atherosclerosis. Testosterone also reduces your risk of metabolic diseases such as diabetes and prediabetes. Here in the US, the CDC estimates that about 22% of adults with diabetes are actually undiagnosed with diabetes. So that is a huge percentage of the population that likely has either prediabetes or type 2 diabetes and just doesn't know it yet, so they don't actually have the diagnosis. This is really common. I see this all the time. If you want to be checking this with your annual labs, which I highly recommend you do, you want to be looking at fasting blood sugar, fasting insulin to make sure you're not insulin resistant, and get your hemoglobin A1C, which is an average of about 120 days. So it really doesn't matter what you've eaten in the last week or so, even if you're trying to be really good all of a sudden for your blood work. So it's more of a true level that is more of the defining lab for diabetes. All right, so now that we know about testosterone and what it does, let's talk about how to use it as a replacement. Testosterone is typically given as a topical cream for women. So it is highly absorbable and highly effective as a topical cream. It's also very safe. Again, testosterone is a controlled substance. Testosterone is typically applied to areas that do not have a lot of follicles. So I said testosterone will increase hair growth. That is especially true of where you apply it. So you don't really want to apply it to the top of the arm here because most people have a lot of hair follicles here. So it will not only produce more hair, but it can darken the hair. You also really want to make sure that you avoid the neck and the face with testosterone application. Generally, the chest as well. That's really true for all hormones. You don't really want to be applying any sort of hormone to the breast and the fatty tissue. So for testosterone, you want to apply to clean skin. This is true for any of the creams. Always apply it to clean skin, to an area that does not have a lot of follicles. So inside of the upper arm, sometimes the inner thigh or the back of the knee even sometimes the back of the shoulders is a common place for women to apply testosterone. The other way that testosterone is often used here in the States is sublingual, which means that it dissolves under your tongue. This is different than oral use. Oral use means that you are swallowing it down and that is going to be digested in your digestive tract, and it has to go through the liver to be metabolized. Sublingual application is actually being absorbed through the tissue in the mouth. And so the absorption and the metabolism is different. You always want to start at a low dose and work your way up. That will decrease risk of side effects. The other main symptom that comes from high testosterone in women, especially if you're using this as a hormone replacement therapy, is going to be acne and irritability. So one of the most common symptoms that my patients come back in with when we've started them at slightly too high of a dose is that they're going to say, I was getting really irritated at like everything. So they switch to taking it or to applying it every other day, or they decrease the dose in half, and that typically resolves it. How fast will you notice the effects of treatment? Emotional and libido changes can happen as fast as 2 to 3 months of use. Improvement in muscle mass, weight, and bone health takes a lot longer. These are areas of the body that just take longer to change and to develop. Typically, you're going to see changes at least 8 months into it, sometimes as early as 4 months into treatment. Sometimes it does take longer. It just depends on the person and everything else going on with you. All right, I am a naturopathic doctor, and while I do prescribe testosterone, let's talk about some natural things that you can do to increase your testosterone levels without using testosterone. So first and foremost, what you put into your body is extremely important. So let's talk about food. Eating more protein and saturated fat increases the production of testosterone, while eating sugar will actually decrease the production of testosterone. And remember, all alcohol is sugar in the body. So you're eating steak for protein and fat. If you pair that with alcohol, you're still getting in all that sugar. So you're not actually getting the benefit of the testosterone from that. Maybe you're negating out the negative effects of the alcohol, but still not really a great choice to try to increase your testosterone. All right, some non-food things that you can do to increase your testosterone. One is going to be to exercise. However, you don't want to do high intensity exercise for long periods of time or day after day. High intensity exercise actually depletes your testosterone. It makes you use it up. So if you are constantly exercising a lot, you aren't giving your body enough time to recover to make up that testosterone. If you are exercising at a high intensity rate, or you're doing vigorous sporting activities, what's considered to be high intensity is going to be slightly different for everyone, because there is a level of what have you built yourself up to be able to do without it actually being super high intensity to your body. So if you don't know what's right for you, I would consult a trainer, a PT, your doc, someone who can help you figure that out. The other big thing is that if you are experiencing a lot of depression or anxiety, anything with a lot of mood swings, you want to go seek help for that, because one, while this is its own thing, testosterone, yes, can be contributing, and so testosterone replacement therapy might be helpful. These huge swings in LH are going to happen from anxiety and depression and these mood swings. So your production of hormones that comes from the production of LH is going to be going like this. So in order to help stabilize your LH, you actually need to work on the anxiety and depression. And so I know it sounds like you're, trying to treat the egg before the chicken, but remember, the chicken comes before the egg. It's one of those weird kind of cycles there where you kind of just need to do everything all at once a lot of times, to be honest. But therapy or seeking help, whether that's using medications or herbs or nutrients, whatever that is for you, meditation, Reiki, whatever it might be, you do still need to work on that, and that will be extremely helpful, and it will actually make the testosterone replacement therapy work better for you. All right, and so last thing I'm going to talk about is just monitoring. So testosterone is a controlled substance. We do need to monitor it to make sure that your levels are safe, also to make sure that you're not misusing it. Yes, there are people who do misuse it. Shocking. When we are rechecking testosterone, we always want to check all of your sex hormones. Nothing plays a role completely on its own. Everything is really tied together. So when I check testosterone, I'm also always checking estrogens and progesterone. I typically we'll check in the blood because testosterone is most accurately measured in the blood. That makes it a little bit tricky because progesterone and estrogen are not most accurately measured in the blood, but at least for safety ranges and for tracking, especially when you're postmenopausal, blood levels are great because you're not going to get a huge fluctuation naturally. Perimenopausal and when you're still menstruating, it's a different story. But blood levels for testosterone are the most helpful. You want to make sure that you're checking estrogen and progesterone to make sure that all three hormones are balanced. You also want to check DHEA. So DHEA is a precursor hormone to testosterone. I mentioned before that LH tells your ovaries to produce testosterone. Well, that's only part of the picture. Some of your testosterone comes from your adrenal glands, and some of it actually comes from DHEA from your adrenal glands. And then that DHEA in the skin and the fat tissue actually gets converted into testosterone. So we need to check your DHEA level as well, because if you have low testosterone, maybe you actually have low adrenal function that needs to be worked on. And it's not just an ovarian or an LH problem. It could be from something else. With testosterone, we often measure the free testosterone or the bioavailable testosterone. So this is more of what's actually active, what you're being able to feel the difference from. The other thing here is sex hormone binding globulin. This is a protein that holds on to the hormones and renders them inactive in a sense. You can actually calculate out the free testosterone if you know your total testosterone and the sex hormone binding globulin. Total testosterone is considered to be more stable than free testosterone. So that's kind of the reasoning behind that. Some people do, some people don't test free testosterone, but you always want to test with sex hormone binding globulin. So that is it. Thank you for watching this. If you found this information useful, please share it with other people that you think would benefit from it. Give me a thumbs up. I would love to know your stories with testosterone, so long as you're okay posting them, because that's personal. That's totally your information and it's private and it's only to be shared if you want it to be shared. That being said, I would love to hear any of your stories that you've had using testosterone, likes, dislikes, any issues you've had. If you have any questions that I did not answer about testosterone replacement therapy, please drop that in the comments below. I would love to read that and get you an answer. All right, enjoy the rest of your day.